Now let's take all of these to Perpetual Ofori-Ampofo. She's the president of the Ghana Registered Nurses and Midwives Association. Thankfully, she's joining us this afternoon here on the bulletin where we can pick immediate thoughts on what government has been saying and the response of the nurses who've been on strike, the effect biting, and we'll be getting details for you shortly. Madam, I appreciate you speaking to us this afternoon far away from Ghana. The government is under pressure. They are appealing to retired nurses and midwives to come back and help shore up the gap you've created. Surely that should be something that in the immediacy moves you and have you consider a return to work.
Thank you very much for having me, and I'm really grateful for this opportunity. You know very well that indeed we started talking about our frustrations with regards to the overly delayed implementation of our collective agreement, not last week, not last 2 weeks, not last month, but from January of this year. And in all those engagements that we had with the Ministry of Health and with the Ministry of Finance, they made us understand that there was a process ongoing for the implementation. All these information that we are receiving now from the meeting we had yesterday with our employers and from the press briefing that has been held by the minister himself, it tells us that it means throughout those follow-ups, all that we were being told were inaccurate information and they were lies. So the point is that nurses and midwives in Ghana deserve to have their collective agreement, which borders on their conditions of service, implemented. We understand it's a new government. That is why even as leaders, from January till somewhere last month, we have been making great excuses for the government. At a point we said, no, this is a new government that has come. Let's wait. A minister of health has not been appointed. Let's wait. A minister of finance has not been appointed. Let's wait. The budget has not been read. Let's wait. We've been given a lot of excuses. And the general membership of the association and the entire fraternity of nurses and midwives have said they are tired of the excuses that we are given. They are working in work settings where other health professionals are benefiting from what they should also be benefiting from. So what stops us from doing the needful? If they are telling us today that there's no room within the budget to cater for what we deserve as nurses and midwives, then they are telling us that they do not value what it is that we do or what we do within the health space. You cannot tell us that within the period of June to December, government is not going to spend. They must make provision in there. And even what we have said is that, yes, if you look at all that we are asking for in terms of the Appendix B, the content of the Appendix B within our collective agreement, we haven't said that, look, implement everything at a go. We are looking at a situation where, for example, you take fuel allowance. We are already taking fuel allowance in terms of our senior grades. Put them on the right rates, which was agreed, which will mean that you are paying up a difference because they are still collecting the old rate. But then once you put them on the new rate, they will be receiving the new rate. And then we can talk about spreading the arrears over a period where you pay them in tranches. Look at uniform allowance. That is a one-time payment. We have received, as of last year, the old rate, which means there's a difference to be paid, and the new rate should be paid this year. In paying the new rate this year, you can add on what was not paid last year and pay it at a go. Book and research allowance, for example, is meant for a small number of our people. They are not even up to 1,000. It's not going for every nurse and midwife in the country. And we are saying, pay that to them. It's a one-off payment. So once you are able to do that, it just gives us room to now sit and look at other things like the on-call facilitation allowance, the rural incentive allowance, and all those allowances that may be contained there. We are very flexible, we are available, we are ready to engage. We don't want anybody making it seem as if the leadership is not ready. Yesterday we were in a meeting. What they told us was that they can only contain the implementation from January of
next
2026.
year. And you find that you find that unacceptable. I want to come
unacceptable.
I want to come to the aspect of your conversation where you say that you had been engaging before the budget was read and all of that, and you pointed out calling the government liars. Who are you engaging between that period until the budget was read, and what was the conversation which you had? Reason for which now you're describing all of the conversations as unacceptable?
In fact, we wrote a letter in February 2025. We wrote another letter, official letter, in April 2025. The first one we wrote in February 2025, we're calling on our employers and all those who were actually served the writ in June 2025. And in fact, the section of our people who took us to court actually took not just GRNMA to court, they took the Ministry of Health, the Fair Wages, Ministry of Finance, Attorney General's Department, and others. So we served them this letter and told them that, look, now consent judgment has been given by the courts. Our collective agreement needs to be implemented. The most pressing one at the time was the CPD. Incorporated there was our PIN and iron renewal, which bordered on the legality of our practice. So we started engaging on that. At this moment, I can say that we've been able to have some closure on that, although not so effective. At least the Minister of Health has been very consistent. We have engaged with the Director General of the Ghana Health Service and the Nursing and Midwifery Council on that, and at least we've made a headway on that. If you put that aside, with all the other items within the collective agreement, we kept putting it across in all those meetings that we had that it is very important that we look at the entirety of the collective agreement and get it implemented, because it is of very important essence to all nurses and midwives.
To all nurses and midwives in the country. But there are those who make the argument that the government, even from this press conference this morning, has not denied the importance you serve in our health delivery system. In fact, they've reiterated that countlessly. We had the Deputy Finance Minister who mentioned that he's not going to describe your action as unfair because you're demanding what is due you. There are those who make the argument that give them a bit more time. Your posture and your insistence that all of these be taken care of before you can return to the negotiation table sometimes looks a bit unfair to the government, which is just, what, barely 6 months?
6 months is a long time. It's half a year. It's a long time. But what we have said over and over again is that if you look at the entirety of the collective agreement, there are aspects that need to be implemented at the work area through the IGF. There are aspects that are monitored, needs to be paid through the controller system. There are aspects that we even need to further engage to look at the modalities of its implementation. So what we have said, and I don't know why they are not getting it, that we are not calling for the implementation of the entirety of the collective agreement at this time. But of course, looking at what it is we are experiencing at the work side, we are all health workers. We are all health workers. We negotiated our collective agreement way back and signed it off in May 2024. As of that time, other professionals have not even gone to the negotiation table to negotiate. As we speak, they are all enjoying these same set of conditions of service. So it is not fair to keep us locked out. Those aspects that actually cuts across, implement them for us at this time, and let us continue to engage with other aspects. And let me tell you, the passion with which we work as nurses and midwives have made it increasingly impossible for sometimes for us to take this kind of position in terms of industrial action. Because right now as we speak, it's biting. In fact, my colleagues have been in and around the country, hospitals here and there, where persons are in desperate need of you nurses and midwives at the respective hospitals. You're speaking to the difficulty in having to arrive at this particular position, but then some will say, look at the patient who, through no fault of theirs, are having to bear the brunt of this decision. Go back to work, return to the negotiation table, have a conversation with government. The truth of the matter is that, yes, we are nurses, we are midwives, we are compassionate with the care that we give. We know our worth. We know what we bring to the table. We know what it is we bring to the health sector. But let me tell you, at this point in time, we must save ourselves in terms of getting what is due us financially, what is due us non-financially, to be able to carry ourselves to work. Because, mind you, it is not as if we receive any kind of transport allowance to get to work. Whatever remuneration we receive at the end of the day, we take care of our rent, we take care of our transport, we take care of every need of ours in terms of what our dependents require from us. What is due us needs to be given to us. I was making a point, and you came in earlier. I'm saying that considering that we value our patients and we love them so much, that is why even within this context, I must tell you, in managing the strike, we have even given directives to our regional branches and our leadership, such that in the very critical areas where we have our patients in critical conditions, adult care or pediatric care, we are putting some kind of skeletal staff there. We are allowing them to care for them until such time that their condition is stable.
That's not happening.
At the same time,
I have colleagues who visited the hospital yesterday, and the nurses were not taking care of them. He had a newborn baby who was expected to undergo some specialist treatment. There were no nurses there, and we'll connect with my colleague shortly. This skeletal system you're talking about, presently as we speak, doesn't appear to be on the ground, which is why the minister is appealing to retired nurses to come and save the day.
To tell you the fact that the provision our employer is putting in place will not solve the issue. You see, if you leave student nurses and you leave rotation nurses, those two categories of nurses are supposed to work under supervision from their senior colleagues. Maybe our employer doesn't know the circumstances under which our retirees are working or are at home. And if you are calling them to come and work, probably you don't understand their circumstance.
You think it's not going to work?
Every retiree, unless those who may have retired this year, if you do your nursing job for as many as 30 years or 35 years, by the time you are retiring, you are down with serious backaches, serious knee problems, and all sorts of medical conditions.
So you think,
and at the time they retire, they are taking care of all these medical challenges, still with financial difficulties. And the system doesn't even take care of them. So if you are calling them at this time to come and work, how are they coming to work?
You think
they are not even available to come and work. The solution to this problem is that the Ministry of Finance must find space within the budget to cater for the more pressing issues that we've already communicated to them, so that the rest of the issues we can actually come to some agreements and have them done over time. That is all that we are calling for. Madam, and we cannot begin to give service at that time when we haven't seen any commitment on the part of our employer to actually see to the conclusion of this matter.
I get it that you're not going to budge on this position. It's a hard pill you're deciding to swallow at this point in time. But we get the indication as well that the National Labour Commission has secured a judgment of some sort from the court describing this industrial action as illegal. In fact, a member from the registered nurses and midwives acceded to the fact that they had received the court processes. Surely that begins to compel you to call off this industrial action, doesn't it?
As far as we are concerned, you know, when it comes to this matter, there are technical matters related to it and legal matters related to it. We haven't been served. And it doesn't take all these things to compel us to go back to work. It will take more than... I'm telling you that the practitioners themselves are resolute.
Right.
I'm not even going to tell them to go to work and they will get up and go to work. Or the National Council. We are looking at a situation where we can get the most pressing issues within our collective agreement implemented. I've mentioned some of them to you on this call. That is what we are pleading with the Ministry of Finance to look at. Our employer, our mother ministry, the Ministry of Health to look at, so that we can continue to engage on the other issues. We are available. We are available to engage. I may be away, but there's a strong team of leaders in Ghana to engage at any point in time when they are called upon. So it is important that they really look at what they can do immediately and stop talking about implementation in January 2026. It will not help anybody. And I'm telling you, the mitigation systems that have been put in place will not solve the issue. Those issues that are of critical nature and has come to our attention, we have helped to resolve them. At this point in time, I'm telling you, nurses and midwives in Ghana are resolute, and they are not going to budge, even if nursing leadership tells them to do one thing or the other. They are looking forward to having their uniform allowance implemented. They are looking forward to having their fuel allowance implemented. They are looking forward to having their book and research allowance implemented, and all other allowances. But like I said, as leaders, we are ready to sit at the table and have some measures put in place that can help spread the arrears and spread out the implementation, as it were. But to wait till January 2026, it is not a fair way of looking at it. And if that is what the position of the employer is, we are going to tell them squarely that they want to treat us unfairly, and it is not just. They must treat us justly so that we feel we've been treated well to be able to call off this industrial action. I
appreciate you speaking to us, Madam, and I'm hopeful that we can have a conversation again shortly. That's Madam Perpetual Ofori-Ampofo. She's the president of the Ghana Registered Nurses and Midwives Association, speaking to us this afternoon, where she, amongst many other things, says, what, the government is treating them unfairly, Kamini? And
indeed,
it's a very strong position they've taken, that they are not budging. They are making sure that what is due them is given to them by the government. And she says that nurses, even if they decide based on this court processes we're learning of by the NLC is served on them, because she says it's not been served on them, they are not sure the nurses will hit to their call if they say they should call the industrial action off.
And you know, she mentioned how in certain areas plans have been made for the nurses to have a lean staff.